the state's acting chief medical officer, and also Dr. Jennifer Davenport, the chief medical officer here at St. James. Thank you, each of you, for being here today. In recent weeks, Montana has seen COVID-19 infections and hospitalizations surge as a result of the Delta variant. While I'm encouraged that Montana saw about 1,000 fewer cases last week than we did the prior week, and hospitalizations in the state have dropped about 15% this last week, this surge has strained our communities, healthcare workers, and our hospitals. Tragically, since the beginning of the pandemic, we've lost 2,225 Montanans to the virus. These are our mothers, fathers, grandmas and grandpas, sons and daughters and friends. Their loss can't be captured by a number, statistic, or a TV screen. These folks are our neighbors, and their loss reminds us of the importance of taking this virus extremely seriously. As we've seen COVID-19 infections and hospitalizations rise, our healthcare workers have been working around the clock to serve, treat, and care for Montanans. These heroes have worked countless hours to save lives. But the fact of the matter is, after 19 months, they're especially strained. They're tired, and we need to continue to do all we can to alleviate the burden that they continue to carry. That's one of the reasons why we're gathered here today. Over the last month and a half, DPHHS has been working diligently to allocate thousands of monoclonal antibody treatments across our state. As of today, and thanks to the work of Dr. Shamanic Cook beside me, the treatment is now accessible in 41 counties in Montana. Much like COVID-19 vaccines, monoclonal antibody treatments are safe, effective, and they've been saving lives in our fight against COVID-19. A few weeks ago, I visited Sydney Health Center out in Sydney, Montana, where they were using monoclonal antibodies as early treatment for vulnerable Montanans infected with the virus. Providers there told me that the monoclonal antibody treatments have been over 97% effective in preventing hospitalizations amongst the most vulnerable. Out of 41 vulnerable Montanans they treated, only one eventually ended up in the hospital. This is a great result. Early treatment with monoclonal antibodies not only reduced the strain on their hospital system and ensured more capacity, it saved lives. And we're seeing the same results at hospitals across our great state. Today, I'm proud to announce the state took the lead and facilitated the opening of a monoclonal antibody clinic right here at St. James. Run by a contractor, Jogan Health, this clinic will reduce the strain on St. James, reduce hospitalizations, and open up ICU beds for the most critical patients. At St. James, they've designed the clinic to be open to the Butte community and to accept referrals from other facilities around the state. Most importantly, it will provide more Montanans access to early treatment, like the elderly and those with severe underlying health conditions. Undoubtedly, this new clinic here at St. James will save more lives. We're fortunate for the partnership we have with St. James and the work we've done planning and preparing in the recent weeks to get this pilot clinic off the ground. Working with hospitals to reduce the strain they are facing has been one of our top priorities, and it's been an all-hands-on-deck effort. In recent weeks, we've mobilized over 100 National Guardsmen to health systems across our state. Stepping up to the plate, the men and women of the National Guard have offered critical support to our hospitals in their response to this virus. Our entire state thanks them for answering the call one more time. Working with DPHHS, we also issued an emergency rule last month to make it easier for hospitals to transfer certain patients to other healthcare facilities. This rule continues to help reduce the burden our providers face and frees up needed hospital beds. A week later, we secured an agreement with the VA and FEMA to use open beds at Fort Harrison VA Medical Center. Over the past few months, we've also worked tirelessly with hospitals to address their COVID-related staffing issues, primarily through working with contract staffing firms to get the right healthcare workers here in Montana. And now, we're making an aggressive push to promote another tool in our toolbox and get more doses of monoclonal antibodies into our communities across the state. This state-facilitated clinic is a model of what can be done in other communities around Montana. And we stand ready to help other facilities and communities get clinics like the one here at St. James up and running. While we know monoclonal antibodies are a proven method of life-saving treatment, vaccines offer a proven method of life-saving prevention. Almost 90% of the COVID patients entering hospitals in Montana since April have not been vaccinated. To get through this pandemic, there's one thing Montanans can do: talk to their trusted personal healthcare provider and get vaccinated. That's what I did. I talked to my doctor and I got vaccinated. And I encourage Montanans to do the same. While we will not mandate vaccines in Montana, the best long-term solution to this crisis is for Montanans to talk to their healthcare provider and get vaccinated. We continue to make progress in this front, with more than 54% of Montanans now fully vaccinated. And we are on the precipice of another milestone. Today, we will have 500,000 people fully vaccinated in Montana. This is no small coincidence that I was here earlier this summer when we administered the 500,000th vaccine here at St. James. Getting vaccinated remains the best way to protect yourself and your loved ones from COVID. The vaccines are safe, they work, and they're saving lives. Today's announcement would not have been possible without the work of Montana's acting Chief Medical Officer, Dr. Maggie Cook-Shamanik. For weeks, Maggie has worked hand in hand with healthcare providers and hospitals to ensure their need for these life-saving treatments are met. She has overseen the allocation of thousands of these treatments every week, and we're grateful to have her on the team. Doctor, would you like to say a few words?
Thank you, Governor. And thanks for the opportunity to make some remarks about the monoclonal antibody treatments, the state-led allocation of these treatments, and then the role of the monoclonals in the larger scheme of the pandemic response. So the monoclonal antibody therapeutics are used to treat eligible non-hospitalized patients who have tested positive for COVID-19 and have mild to moderate symptoms. So eligible patients have underlying medical conditions or other factors that place them at high risk for progression to severe COVID-19, including hospitalization or death. The treatment is initiated early in the course of symptoms and, in fact, within 10 days of the onset. You may be eligible for these treatments if you test positive and are classified as high risk per the emergency use authorization. So this might be based on your age, for example, being over 65 years of age, if you have things like chronic lung or kidney disease, if you have heart disease, if you're immunosuppressed or have diabetes, among other conditions. So our bodies naturally make antibodies to fight infections. These treatments mimic our immune system's response to SARS-CoV-2, which is the virus that causes COVID-19. This antibody binds to the virus spike protein and blocks attachment to the human cell. The state receives a weekly allocation of the monoclonal antibody products based on case burden in the state and utilization in the prior week. So similar to prior state-led therapeutic distributions in the past 2 years, the state reaches out through a variety of channels to identify facilities and providers who might be interested in administering this product. So the Montana Hospital Association and the Montana Primary Care Association have been great partners in this effort. The state also engages in direct outreach to support facilities to ensure their supplies are adequate and to answer any questions that might arise. Fortunately, the state allocation has been sufficient to meet the requests of all facilities to date. When you're looking for the monoclonal antibody treatments, your medical providers will be the most reliable resource for identifying a community treatment site, and the treatments will require a provider order. The monoclonal antibodies, as the governor mentioned, have been distributed to 41 Montana counties through the state-led efforts, and we add more sites to the state efforts every week. I want to take a moment to reinforce the role of the monoclonal antibody treatments in the larger pandemic response. So vaccination remains central to the intermediate and long-term pandemic response. Monoclonal antibodies are important for preventing hospitalization and death. They are not a replacement for vaccination. Our hospitals remain stressed, particularly for ICU level care. The community plays an important role in decreasing the burden on our hospitals so our family and friends can continue to receive timely and appropriate medical care for all conditions, COVID-related or non-COVID related. Community support is especially important right now because seasonal respiratory illnesses typically appear at this time. Influenza is of primary concern as we approach winter. I encourage everyone who is eligible to receive a COVID-19 and influenza vaccination to wear a mask when appropriate and to quarantine or isolate if advised to do so by local public health. I want to take a moment to thank our healthcare workers who continue to provide exceptional care for our families and to meet all of our community's medical needs. And I want to thank the local public health, because their tireless work using tried and true core public health measures have kept us safe.
That are sick with COVID-19. If you're infected with COVID-19, see your provider. If you qualify for monoclonal antibody infusions, they will set up an appointment for you. Whether you're in Dillon or Deer Lodge or Ennis, we can help take care of you, just like we take care of our Butte community here with the monoclonal antibody. But the monoclonal antibody, as Dr. Cook-Shamanik said, is not a solution. It's a treatment if you've already been infected, and it does help reduce the risk of hospitalization and death. But vaccine is our one tried and true solution to getting through this pandemic together and supporting our community. So please do your part and get vaccinated. And please thank a healthcare worker today. They really could use it.
Thank you, Doctor, and thank you for your continued work through this pandemic. Director Meyer, would you like to make a few comments?
First, I want to thank St. James for their collaboration, raising their hand to really serve as a community hub and expanding access for this critical service. It really is one more tool to reduce hospitalizations. We are at DPHHS continuing to expand monoclonal antibody treatment as we receive expanded doses within our allocation. And as Dr. Cook-Shamanik said, we're now in 41 out of 56 counties, so we're making great progress there. I do want to especially thank Dr. Cook-Shamanik. She has been a great, for her leadership and her coordination. I can't thank her enough for her public service and the countless hours she's putting in and her tremendous counsel as we go through this pandemic together. I do look at this collaboration with St. James as a pilot that can really serve as a framework for other communities looking to expand access to this early intervention that can save lives. So if there are other interested communities, hospitals, providers, please don't hesitate to reach out. We will be more than happy to find ways to collaborate to expand access in your communities, to develop these community hubs. And I also want to reinforce, just thank a healthcare worker, thank a public health worker. They've been at this for a long time, countless hours. And it is thankless and it's tireless, and they're going in every day, and we need to do what we can to mitigate that. And we also need to do what we can to show our appreciation for what they're doing day in and day out. And so with that, I'll turn it over to the governor and see if we'll close things up.
Great, thank you, Adam. And with that, I'll open it up for questions. Yes.
Maybe one for Dr. Kuchmanik about the monoclonal antibodies. What type of monoclonal antibodies is the state currently receiving, and how many doses on a, I think you said weekly basis? Can you give us a rough estimate?
Sure. And so again, those calculations are based on the case burden. HHS uses the case burden and utilization rates from the prior week to calculate that. So for example, this week we received over 2,000 monoclonal antibody courses. The majority this week was casirivimab and imdevimab, which is the Regeneron product. We also received bamlanivimab and etesevimab and sotrovimab. So all three of those products are currently available through the HHS allocation.
Question for you. When the FDA or if the FDA approves the Pfizer shot for 5 to 11-year-olds, wondering what your plan is for either encouraging or passing information to kids and their parents.
Yeah, I think my comments stand. The vaccine is a very effective way, the most effective way we have to stop the spread of this virus. We're going to continue to encourage Montanans to get vaccinated because it's the best way to protect themselves and their families.
Any specific plans for encouraging that 5 to 11-year-olds?
We will have to see what guidance we get from that accompanies the approval, and we'll make decisions based on that.
I wanted to ask Governor,
Holly? Yeah.
if you feel that the pace of vaccination, I know you talked about sort of how it's getting 500,000 Montanans today. Do you feel like the pace that we're at right now is sufficient? And if not, you understand that you've encouraged people when you talked about your own experience with vaccination, but it's not sufficient, and that's what we've been trying. If there are other things to try to increase that pace.
Yeah, we will continue to encourage Montanans to talk to their medical provider and get vaccinated. I would like to see it go faster, recognizing that I think our role in government is to educate, communicate, it's not to mandate. And particularly those that have not chosen to get vaccinated, mandates tend to increase hesitancy, not encourage it. So we want to continue to do this. I think in the work that DPHHS is doing, the people that have the most credibility with vaccine hesitant people are their peers and the medical community, not government officials. So I could do all I want, but we need friends to tell friends that they got it and it helped them.
Has there been, I know I interviewed the director earlier this summer, you talked about there were different things DPHHS was doing as kind of maybe survey communities or get more information to inform the
Yeah. Do you want to address that, Adam?
how to shape the message that you're putting out there?
Sure, yeah. So I think we've done about 3 different rounds of different surveys that include both quantitative and qualitative analysis. And with this last round of surveys, actually what we did was we narrowed the focus groups or the survey to those who are unvaccinated to figure out what kind of messages really move them. And what we're seeing is, it's some of the same themes, but trying to figure out the combinations of messages that work well together. And so we should have the newest round of PSAs rolling out here shortly, but they will be informed, and it's a lot of things the governor was just talking about. It's having that message come from a peer or a trusted provider, somebody who's been through it, somebody who was maybe initially vaccine hesitant, who then either got sick or got vaccinated. So trying to find not just the message that works, but the right messengers to deliver those messages that people who are hesitant to get a vaccine will be most receptive to.
Yes.
Have you noticed, and I mean we've reiterated multiple times, that this treatment isn't a replacement for the vaccine, but have you noticed in the 41 counties where it's already been implemented, have vaccine rates increased or dropped at all, or have they just stayed the same as people understand there's something else out there?
Do we have data?
I can't answer that. I don't.
Yeah, I don't know that we have that data available here.
And then another one is our healthcare workers. This process takes about 20 minutes to get the entire IV injection, and then a healthcare worker has to sit with them for around 45 minutes to an hour to make sure they're not feeling any effects. Are we concerned about healthcare staffing, especially as we're in these different crisis situations? Do we have any major things that we're looking at when it comes to that aspect.
Yeah, thank you so much. And you're correct. The administration of the monoclonal antibodies takes 20 minutes to a half hour, and then there's about an hour of observation afterwards. The clinic that we're setting up here, as I understand from Dr. Davenport, will handle about 12 patients a day. And what is important about this clinic is we're using third-party resources. We're not using hospital resources. We're using hospital facility, but it's Jogan Health, which is a private contractor that the state has arranged for funding for, so we're not consuming hospital resources in administering the monoclonal antibodies. I don't know, Dr. Davenport, if you want to comment?
That's correct.
Yeah.
Sure. So to date, what we have been doing is staffing with some of our nursing that's available in the hospital. And so we have been offering this treatment for several weeks. Unfortunately, we're very full at times, and so we need our nurses to concentrate on the patients that are in the hospital. And when our staffing is pushed to its limits, we need help. So we've only been able to do the antibodies on certain days of the week and only a certain number of patients. And all of the other regional hospitals have been struggling with the same issues. So that's why this is such a gift to us, to be able to have consistent staffing, to be able to offer this consistently for all Southwest Montanans.
Yeah, I'll let Adam address the funding.
So in terms of the funding, the department will be putting up the initial funding, and then we'll be submitting for FEMA reimbursement for the COVID-related costs that are eligible.
Just with the funding, is this is this offered free to patients, or how is this going to be paid for? I mean, for the patients?
I think it is, right?
So,
I think it depends on their. I think it's individualized, right?
It really is dependent on insurance.
It's depending on their individual insurance and coverages and stuff.
Right. Okay.
The product itself is free. This is something that the federal government has purchased and is giving to the states. So from a product perspective, the cost comes in with the infusion.
Is Oregon Health the only contractor you're using, or is it different in different counties?
Jogan Health is the one that we're using here.
Okay.
I don't know if we want to talk about other vendors.
As of now, most of the hospitals and health systems are managing their own contracts with a myriad of vendors, contractors, to supplement their existing staff. And then we'll continue as we look to expand. If others are wanting to expand, we'll continue to look at all available contractors willing to provide this service. And you know, the main thing is that they're able to provide appropriate and qualified people to be able to deliver the service, and that's been the challenge.
And I think the message for today is this is the first one that the state is doing, and we want to do more. So if there are other facilities, they should reach out to DPHHS, and we'll have conversations with them about getting similar clinics set up to supplement their staffing so we can keep more people out of ICU and save lives. Yes?
Just going back to the vaccination strategy, I don't think that there's been any indication that medical providers are wavering when they're talking to their patients about the importance of vaccinations. I think that's been a pretty consistent message from most medical providers. So it seems like if there was something that collectively Montana could be doing more, it would be a message from political representatives, people in elected positions of power. I mean, unless you're asking medical providers to do more in terms of asking and recommending the vaccine, do you recognize that you could be doing more to specifically speak to your constituents who might not have gotten vaccinated and are looking for a message from their elected leader?
Yeah, I'm going to continue to be very clear. And I'm encouraging Montanans to do exactly what I did. Talk to your medical provider and get vaccinated. The vaccines are safe and effective, and it's the best way for you to protect yourself and your family.
I mean, I know that, like, you've been doing many county tours, county by county tours across the state. Is this something that you're making a point to speak about in counties with low vaccination rates when you're traveling the state, or are you focused on other priorities?
Yes, I do focus on it. Okay, any other questions?
Yeah. We've got the vaccine coming out probably early next month for the 5 to 11-year-olds. Is Montana prepared to accept those and distribute those? And where are we at with that?
Sure. Yes, we're in the process of planning right now. We have a very robust vaccination program with a lot of support for sites that are vaccine providers. And so planning is in effect at this time in anticipation that at the end of the month and early November that there will be a vaccine available for 5 to 11-year-olds.
So is it looking at the existing system, or are you bringing pediatricians in, or schools, or?
So pediatricians have always been a part of the vaccination effort since 12 plus have been eligible. And so it's right now is an opportunity for people to come on, or clinics to come on as vaccine providers. And so we're certainly encouraging that and doing outreach around it.
Would schools be part of it too, do you know, or is that not clear yet?
That isn't clear. I'm not sure if schools will be.
Yeah, and it's typically, it would be the existing kind of infrastructure
In the county.
Just a quick point of clarification question. So is it you need to test within 10 days of first having symptoms to get it, or is there a timeline in particular that you need to qualify for this?
I'm not the doctor.
Right.
Within 10 days of symptom onset, you do have to have a positive test, and within 10 days of symptom onset.
Are we expecting to prepare for more rapid tests, or get the more rapid tests in the state of Montana in order to accommodate for that?
We do have access to rapid testing, so it would be through those avenues, or PCR testing. It can be either one. It can be a rapid test or PCR.
Could you walk through, this is probably for the doctor too, but I'm wondering in terms of this treatment being most effective, is it best to catch patients very early when their symptoms are too severe, or when is this drug the most effective?
Yeah, the earliest after the onset of symptoms is best in terms of the initiation of this treatment. Yes.
Okay.
Hey, Governor, if
John.
nobody else has any questions about the medical thing, can I ask another question to you about another state issue that's very important?
Okay.
As far as the resettlement issue, I know you and Senator Daines are asking the president to maybe tighten up their vetting of people resettling, especially here, I guess, in Missoula. Can I ask, what prompted that? Why do you feel this is important?
We had a tragic development in Missoula yesterday. It was brought to our attention from DPHHS. We will continue to welcome. We will continue to. We support providing a home for our Afghan allies that have been fully vetted. We had a tragic situation with alleged sexual assault yesterday with someone who arrived here in the state earlier this month. And I called on the Biden administration. This individual did not have an SIV status. And I called on the Biden administration to assure us that these refugees are fully vetted. It's not clear to us that occurred in this situation. So we're asking the Biden administration to halt the placement of refugees here until they can assure us that the people that are being placed, our allies are being placed here, have been fully vetted. That's what prompted it.
What indication do you have that he wasn't fully vetted?
We don't have all the data yet. And I'm gonna leave it until the analysis is done. But we have asked the Biden administration for assurances that anyone placed in Montana is fully vetted, and we're asking them to halt any new relocations to Montana until they provide that assurance.
And good Governor, do we know, are you guys certain this is an Afghan, I guess, I don't know, refugee or just somebody else? Do we know if they're connected to that resettlement, this alleged suspect?
The alleged perpetrator was relocated here from Afghanistan in the beginning of October. So I'm going to keep it there. I want to thank you all for coming out, and I appreciate your attention today.